Ladies, I need to be honest with you today. As a doctor who has worked with thousands of women over 60, I see the same mistakes over and over again at medical appointments. And the truth is, they're costing you peace of mind, quality care, and in some cases, your health. This is the ugly truth. What you forget to do during those appointments matters more than you think. So if you're over 60, I'm going to walk you through the most common slip-ups, how to fix them, and what your doctor really wishes you'd do instead. Watch to the end, because the last one, #7, is a mistake that even I once ignored, and it nearly cost my own mother her life. And while you're here, give this video a thumbs up, subscribe, and tell me in the comments, what's one thing you wish your doctor would actually listen to? Let's dive in. 1. Not bringing a full list of medications, including over-the-counter ones. This is the number one thing I see older patients skip, and I don't blame you. You're busy. Maybe you've been on the same prescriptions for years. Maybe you think the doctor already has it in the system. But here's the reality. Electronic medical records are often outdated, incomplete, or missing key details. If you went to a different specialist 6 months ago and they changed your dosage and your GP doesn't have it updated, that's a problem. And if you're also taking supplements, things like magnesium, turmeric, St. John's wort, or glucosamine, and you don't mention them, some of those can interact with your prescriptions in dangerous ways. Let me give you a quick story. One of my patients, a 73-year-old woman named Carol, started taking an over-the-counter cold medicine. She didn't think much of it, just something she picked up at the chemist. She came in dizzy, nauseated, heart racing. Turns out the cold medicine was interacting with her blood pressure meds. She could have had a stroke, all because she didn't think the non-prescription stuff mattered. What you need to do, create a full medication list. Write it down or keep it on your phone. Include prescription meds, over-the-counter pills, supplements or vitamins, creams or topical treatments, drops, sprays, anything you put on or in your body regularly. Bring it to every appointment, even if you think they already have it. Trust me, they'll thank you for it. 2. Forgetting to mention minor symptoms because you don't want to complain. This one breaks my heart because it's often tied to modesty or old school conditioning. So many older women come in and say things like, "Oh, it's probably nothing. It just happens sometimes. I didn't want to take up time with it." But let me tell you something important. Your body speaks in whispers before it screams. And if you ignore the whispers, you might not catch the problem until it's too loud to ignore. That slight shortness of breath might be early heart issues. That occasional leak when you laugh could be a sign of pelvic floor dysfunction, which is treatable. The mild but persistent backache could be a sign of kidney trouble or osteoporosis. Let me tell you about Martha, one of the sweetest patients I ever had. She was 78. She came in for her annual physical, and when I asked how she'd been feeling, she smiled and said, "Oh, just the usual old lady aches. A little bloating, a little fatigue. Probably nothing." But something about how she said it made me ask more questions. Turned out she had early-stage ovarian cancer. Because she mentioned it, even just in passing, we were able to catch it in time. She's still alive today. Here's what I want you to do. Every time something in your body feels off, write it down in a little notebook or on your phone. Doesn't matter how small. Bring that list with you and go through it, even if it feels silly. You are not complaining. You are being proactive. And remember, a good doctor listens. A great one asks follow-ups. 3. Not asking questions because you feel rushed. Let's be real. Most doctors' offices these days run on tight schedules. You wait 40 minutes and get 12 minutes of FaceTime, if you're lucky. But here's the problem. You've been taught to be nice, to respect the doctor's time, and to get in and out without causing trouble. So you smile, nod, and leave even when you didn't understand half of what was said. But what's the point of seeing a doctor if you walk out confused or unsure? You're not there to perform politeness. You're there to get help. Let me give you an example. I once had a patient who was prescribed a new heart medication. She nodded through the instructions, took it home, and began taking it immediately. But she didn't understand that it had to be taken with food. She started having terrible stomach pain and nearly quit the medication, which could have been dangerous, all because she was afraid to say, "Wait, can you explain that again?" So here's what I want you to do. Bring a piece of paper with 3 questions written down. Don't leave until they're answered. If you feel rushed, say, "I still have a few questions I'd like answered, please." If the doctor sighs, acts annoyed, or doesn't make time, that's their problem, not yours. And if they treat you like you're a burden, find a doctor who values you, because they're out there, and you deserve one for not bringing a second set of ears, especially for important appointments. You know what happens when you walk into an appointment feeling nervous or overwhelmed? Your brain doesn't process things the same way. Even the calmest person forgets details when emotions are high. And this isn't about age. It's about being human. Think about the last time you got unexpected news. Did you remember every word, or did it all become a blur? I had a patient, Deborah, who came in for test results. She came alone, confident she could handle it. I had to tell her we'd found something concerning in her scans. She nodded, asked no questions, thanked me, and left. The next day, her daughter called me in a panic. Deborah had told her, "I think the doctor said something was wrong with my kidney or liver. I can't remember which." Imagine living with that fear and confusion for 24 hours. What should you do? Bring someone with you. A daughter, son, partner, friend. Someone who can take notes, ask questions, and support you emotionally. And if that's not possible, ask your doctor if you can record the conversation. Most will say yes. Say, "This is just so I can remember everything properly later." Because when you're clear on what's happening, you can take control of your care. You're not being dramatic. You're being responsible. 5. Downplaying mental or emotional health. Let's talk about something most women don't bring up at the doctor's office, but should. When I ask women in their 60s, 70s, even 80s how they're doing emotionally, I usually get some version of this. "Oh, I'm fine. Just tired lately." Or, "I've been a little weepy, but that's normal, right?" Or, "Well, I don't sleep as well as I used to, but it's nothing really." Here's what I want you to understand. Emotional and mental health is just as important as physical health. You would never ignore chest pain, right? So why ignore persistent sadness, anxiety, or forgetfulness? Depression doesn't always look like crying in a dark room. Sometimes it looks like sleeping more than usual, losing interest in things you used to enjoy, being irritable for no reason, feeling numb or disconnected from others. And memory issues, they're not always just aging. Some forgetfulness is normal, yes, but if it's affecting your daily life, or if it's progressing, it could be the early signs of mild cognitive impairment, thyroid issues, or even medication side effects. Let me tell you about Eileen. She was 76 and had always been cheerful. But when I saw her for her yearly checkup, she seemed flat. She said, "Oh, I'm just getting older, I guess. Not much to get excited about anymore." I gently pushed. We talked. Turns out she'd lost 2 close friends in the last year and had been quietly slipping into depression. We got her support, changed one of her medications that was making it worse, and now she volunteers at a local garden group and smiles when she talks about it. Here's your takeaway. Don't dismiss how you feel. Write it down. Tell your doctor, even if it's hard, even if it feels silly. You're allowed to ask for help. You deserve to feel whole inside and out. 6. Not advocating for yourself when something feels off. Now, this one makes my blood boil because I've seen the consequences up close, and they're heartbreaking. Too many older women silence their intuition. They sit in front of a doctor, maybe one in a white coat, maybe with a fancy degree on the wall, and they ignore their gut because they don't want to be labeled difficult. Let me say this clearly. If something doesn't feel right, you are allowed to speak up. You don't need a medical degree to know when your body is off. You've lived in it for decades. That counts for something. I'll never forget my patient Sandra. She was 71, active, sharp, and strong. She came in 3 times in 1 year with a strange pain in her upper abdomen. Her previous doctor, a male doctor she'd seen for 20 years, told her it was just acid reflux and gave her antacids. By the time I saw her, she'd lost weight and was pale. It was pancreatic cancer. We caught it, but late. And what haunts me is that she knew something was wrong months before. She told me, I just didn't want to go over his head. I figured he knew better than me. Ladies, no more of that. If your doctor dismisses your concerns, interrupts you, or doesn't take you seriously, you don't owe them loyalty. This is your life, your body, your health. Here's what to do. If something feels off, say this. I understand your point, but I still feel like something isn't right. Can we explore this a little further? If they roll their eyes, brush you off, or act annoyed, get a second opinion. Don't wait. The best doctor's partner with you. The worst doctors make you feel small. 7. Skipping preventive screenings because I feel fine. This one might be the most dangerous mistake of all, and unfortunately, it's incredibly common. I hear this all the time. Oh, I don't need a colonoscopy. I feel fine. I'm not doing another mammogram. They're uncomfortable, and I've never had a lump. I'm too old for a pap smear. That's for younger women. But here's the truth that no one likes to say out loud. Most serious conditions, especially in their early stages, have no symptoms. You can feel fine right up until you don't. And by then, it may be too late. I'll share something personal. My own mother, a strong, independent 68-year-old at the time, skipped her colonoscopy, said she was healthy, ate well, exercised. When she finally got one done, they found a cancerous polyp. Early stage, thank God. We were lucky, but we almost weren't. She told me later, I thought that stuff was for people with symptoms. I didn't realize it could be hiding there, silent. Preventive screenings aren't about today. They're about tomorrow. They are your safety net, your early warning system. They exist because doctors know that disease doesn't always knock on the door. Sometimes it slips in quietly. Here's what you should do. Ask your doctor, what screenings am I due for based on my age and history? Follow through, even if they're uncomfortable, even if you feel fine. Put them on the calendar like you would a hair appointment, because your life is worth protecting, even when it's inconvenient.